Thank you very much, Jim. We've heard many times about the importance of the states as players. From the perspective of the National Governors Association, we'll now hear from Hemi Tewarson.
Hi, everyone. Well, I'm the last person on the panel, and so I'm going to shorten my remarks and just really hit the highlights. First of all, thank you for having me. One of the things that we do at the NGA is we are bipartisan. So we work with Democratic governors and Republican governors. And one of the things you heard on the last panel was Medicaid is a huge, huge part of state budgets. In some states, 30% of the budget. And guess what? Governors have to balance their budgets every year. So there is a pressure there for states to innovate, particularly in their Medicaid program, but also thinking about multi-payer solutions. And so I was so pleased to read the Vital Directions for Health and Healthcare, and congratulations on the Academy for putting together such a high-quality report. All of the things, as I read, are things that we have been working on for a couple of years. So it's really great to see that published in this kind of forum, because one of the things we've been doing for the past couple of years is trying to help governors and their staff figure out solutions on how to be more efficient and improve outcomes for their state residents. That's it. And how do you do that? It is hard. It is difficult. There is no easy solutions. There's not one solution. And so, all the different things that the papers reflect on, complex care patients, the 5% of the population that's over 50% of the spend. We spent 3 years working on that with states, trying to figure out solutions. I think we worked with 12 states. Trying to break apart, how do you even start working with that population? What are the potential solutions? So that really was something that had a lot of a synergy with the work we were already doing. Another area, housing is healthcare. So when we talk about social determinants, one of the things we found in those high needs, high cost patients, guess what? Majority need housing, majority have behavioral health challenges, and so by doing case management and providing them with those supportive services, which is not traditional healthcare, you bring down the cost of the ER visits, you bring down the cost of the inpatient admissions. And that's what's making a difference from a governor's perspective in terms of what you're spending on them. And by the way, it also improves their outcomes. So, thinking about how to take those complex pieces and breaking it apart into doable, actionable steps for states is what we do in the Center for Best Practices at NGA. And one of the things I wanted to reflect on was, in the context of health reform, we're spending a lot of our time thinking about the potential implications for states in the health reform debate. Great concern around I think the Medicaid cuts for many governors, who might be faced with choices of reducing coverage, reducing benefits, reducing provider payments. What are the other options? And so from our perspective, continuing to focus on those other areas where we're driving value into the system is really important. And I think Vital Directions is one of the ways we can actually do that and build those types of partnerships with all the folks that are here sitting at the table, because the states aren't going to do it on their own. I think there's a push from Congress and the administration that states are the innovators. They're going to be the laboratories. One of the things that I'm concerned about, based on all of our work with states, is states are trying to make progress and innovation, but there was investment, there was funding, there was effort put into those all those initiatives, and how is that going to be impacted if there's less federal dollars on the table for them to actually run their Medicaid program? And so, where we're really focusing our attention is how do we continue the movement of driving value into the system? And I think, building off of Vital Directions, these cross-sector partnerships where we're really talking about, it's the private sector, it's Medicare, it's the payers, it's, the physicians. How do we kind of really work on that together? The other comment I would make is we also have to think about, and you heard a lot about this in the last panel, the cross-sector piece. It's siloed at the federal government. By the way, it's also siloed at the state level. So, we are spending a lot of time thinking about how to break down those silos and create more of a continuum across, thinking about healthcare, build in education, build in your housing folks, build in your corrections folks. How do you really build a platform across all of those different pieces of state government in a way that makes sense and in a way that we can actually move forward on social determinants? The one thing I'll just end with is, the challenges, and we were asked to speak about challenges. One of the challenges I see is really from a state perspective, making sure that they have the support they need to actually continue to innovate. And so continuing to bring very practical and pragmatic solutions to them is what we do, and we'd like to get support from partners across the spectrum. Thank you.